Welcome all to an Access Technologies and Healthcare podcast episode. I am your host, Matt Kjin, Segment Development Manager for Healthcare here at Access Americas. And I am joined today by two guests. Well, one co-host, one guest, most certainly. So Mr. Paul Baratta, who is the Segment Development Manager for Healthcare here at Access Americas, and Gloria Graham, who is the System Director of Public Safety and Emergency Management at Lee Health. Paul, let's start with you. If you can kind of tell the audience a little bit about yourself and your background.
Sure. So I was in law enforcement for about 26 years and went at the end of my career, went to Beth Israel Deaconess Medical Center in Boston, where I was the chief of police and director of public safety. And while there, brought in an armed police department, certified department, and worked there for about 9 years, building up the department. We went from an external contract security force to an internal police department and security force. Came to Access about 9 years ago, and I oversee the healthcare segment, and we work together in making sure that Access has the right tools and the right information for healthcare, so that we're leading in healthcare for people like Gloria, to make sure she has the right solutions, so that we can keep people safe, hospitals smarter, and also provide high-end solutions that work in healthcare.
Absolutely. No, thank you for that. And also, I always kind of like to say it too, is like, we bring the voice of the customer to Access and really help us align.
Correct.
Yeah, absolutely. Gloria, if you don't mind, could you give us a little bit about your background?
Sure. I've worked also in law enforcement for about 25 years at a number of different institutions across the country. And then 5 years ago, pivoted all the way into healthcare. And so while I had responsibility for healthcare safety and security at some of the organizations that I worked with during my law enforcement career, I had never been embedded in a hospital and solely responsible for public safety operations within a hospital system. And so I was fortunate enough to join Lee Health in 2020 and am 5 years in and oversee public safety operations as well as emergency management for our health system.
Fantastic. And I think to kind of help out with like the housekeeping aspect, we should probably kind of let people know about what we're going to be talking about here too. So what I really want to focus for this podcast series is the human element.
Yep.
So we're talking people, process, technology, to quote you. So it's funny me saying that to you, but here we are. And then I really want to like understand, and I want the audience to get a good idea of how the humans are interacting with the technology and benefiting from it. So, and again, from a programmatic oversight perspective, okay?
Yep.
And so, Paul, with that, why don't you kind of kick us off of where you want us to go?
Yeah, so I guess if we can, Gloria, I'd like to really talk about what you do today with technology, what programs you have in place and solutions, and how they benefit not only your department, but the patients, which is probably, when you're in a healthcare environment, it's patients first, and then staff, and then visitors. And how does that all work together? I know it's a challenge too.
Yeah. I mean, we're very technology rich. We have, everything from your traditional video cameras and access control points to electronic visitor management systems, so that we can allow the people who need to visit to come and visit, and perhaps deter the people who shouldn't come to visit from visiting or attempting to visit. And then there's so much technology that's within a healthcare system, much of which you might initially think that it's clinical in nature, but those clinical systems and that clinical technology also oftentimes is triggering public safety to act on something. And so, my immediate thoughts are some of our codes that happen throughout the system, where maybe there is an emergency involving a patient. And while, yes, the clinical team needs to respond to that, you also have to have public safety officers and a litany of other folks and resources that are responding to that. So there's everything that we do throughout the day is going to be riddled in technology.
And I think sometimes you're the unsung heroes in the hospital as well. I mean, you're responding to patient incidents, you're responding to infrastructure incidents. I always used to say that we're the canaries. We run into the building instead of run out of the building. And it's something that, when you're looking at the infrastructure and protecting the infrastructure of the hospital, which is always a challenge as well. Have you used any technology for, say, ensuring hazardous materials areas, irradiators, and things like that? Um, and can you tell us a little bit how it's changed even in the 5 years that you've been there?
Yeah, sure. I think the way that I always approach things is, for one, I think about the overall mission and goal of our department. And we truly are there for, as you mentioned, Paul, the safety of our patients and our colleagues and our patients' family members and then other visitors as well. And we really have to make sure, our at the end of the day, if you had me summarize in a sentence, what is it that you do? My mission is to make sure that the healing environment is safe so that healing can go on. And in order to do that, I've got to make sure that the healers are safe, and I've also got to make sure that my own team members are safe.
Right.
So I spend just as much time thinking about the things I'm asking our team to do and making sure that I can have them do that in as safe way as possible, as I do thinking about how we as a team can make people safe within our health system. And so, to more briefly answer your question, I guess, and get to the point, I think about things like, creating situational awareness for our officers. So when they are having to respond to that irradiator or alarm, or they are responding to an area where we know that there's something volatile happening, that we can create situational awareness for them by creating a picture, pulling up the appropriate cameras, looking at various alarms in the area, what's happening, and then being able to provide them that real-time information so that they know what to expect, or if they know maybe I need to put my brakes on and slow down and not rush in, right?
Right.
Which is public safety folks, that's what we do. And sometimes that's completely antithetical to what we need to do, because we're not going to be safe if we're running in and harming ourselves. We're not going to be able to help others.
Right. And I can say that in the 5 years that you've been there, I've seen some really positive changes in that the way the staff reacts to things, the way they respond, the proactiveness that you've established even in the dispatch center and things like that. And it's not easy, that balancing act, right? Of you have a level of security, but you also need to have a level of protection. And how do you make sure that the hospital isn't a prison, that somebody can come in and see their loved one, but you have a level of security there that keeps them safe. And personally, I've seen the difference, and I really commend you for what you've done over the last 5 years.
Thank you. I appreciate that.
You're welcome.
I really do.
Yeah. And
You're welcome.
And I think you said something there that really struck a chord, and I kind of want to unpack it a little bit. So, and hospitals are very siloed. They're very much, this department is facilitating this task, this department's facilitating this task, and I don't see enough cohesion where I would like it to kind of be. I think, as you said, that we want to keep the care provider safe, and these we kind of call them domains, and you could chop it up any way you want. You could do this 100 different ways, and none of it's wrong. We always kind of say, like, there's like the security teams, and there's the operations teams, which is like the care providers, and then there's like the business side of the organization, and I really want to talk about how like they can better work together, and it sounds like you're seeing successes in that. So when they get split up and they get too, like isolated in their domain, they start implementing systems that they don't have interoperability. They're not necessarily enterprise grade platforms. They're not scalable to where the long-term vision of the organization needs to go. And it's not necessarily done maliciously. It's just done because it checks the checkbox today, or it has a widget that we liked when we saw it, and so we implement it, and interoperability goes out the window because of convenience in the moment. It also kind of relates to like how much of the system they're implementing and using at launch. If they're utilizing 90% of the system at launch, well, you've probably already outgrown it. And so you probably want to be like the adverse ratio of that. We're more like I'm using 10, 20% of the system. But I want to hear from you how you're working with these other teams or these other departments within the hospital to really kind of like move the needle.
Yeah. I mean, I'll even throw in another wrinkle. We're a multi-hospital system, right? So not only do you have those different competing interests or ideas or projects, but you have that times 5, and then throw in our non-hospital based locations, right? So lots going on at any given moment. And And I will say our system a few years ago did take on a project of really reviewing all of our contracts and starting to look at what does this contract do, right? What does this software do? And so, two things come to mind for me where we hitchhiked on somebody else's system in one instance, and then we encouraged our fire safety folks to hitchhike on ours in another instance. So the first one is we have our own public safety technology team. So while the system has a very robust information systems department, we manage the public safety technology pieces of things, both the project management as well as the maintenance. And so in installation and maintenance, we of course do that through integrators, but we were having trouble kind of justifying needing more people. And so we were manually keeping track of how many calls for service we were getting, albeit a door offline or whatever, a camera not working, whatever the case may be. So we wanted to be able to hire more people for our team, proprietary team members. Mm-hmm. And so we got with information services because they have a ticketing system, and that we tossed it out to them and said, hey, we're really doing IT ticketing too. And so they were able to build us a partition and build us a way for us to track those calls for service that we're getting. It's now part of our monthly report, our annual statistics. We're able to then justify we were able to justify an additional person. We're now even we're expanding that to where even people needing adjustments to card access, because I would argue that we need a full-time person doing credential management on our team. And so we just are getting ready to automate those requests now, because right now they're a phone call to, my friend who I know can change it for me in public safety, or an email or what have you. So from both an accountability and an efficiency, we're automating that process. So the flip side of that is that our fire safety folks, they do a number of tests and drills on fire alarms and what have you, much of which we document for them because we do it in partnership with them. But I offered them the ability to have credentials to write reports within our incident management system, so that when they're writing fire reports and that sort of thing, they don't need to purchase another. They were still doing it manually, of course, right? Mm-hmm. But now we have the ability. We created them an activity code. They write their own incident reports in there. They have credentials. They can pull their statistics and their numbers and reports very quickly.
So there's a couple things inside of there too that I want to get you a little bit more expansion on, is specifically like with access control. Mm-hmm. There is probably not at least from the security domain perspective, a system that gets utilized by other departments, other domains, other people's systems more than that. Mm-hmm. And you'll find out real quick when a door ain't working. You're going to know about it real quick. Or my badge doesn't work, I can't get in here. And you're like, well, yeah. So that's one that if that doesn't work, that doesn't translate like a very good optics for the security team and like the decisions of which were made. But the other thing that you had spoke about too was you were utilizing for the reporting system. So how does the organization view a win like that, where you are partnered up? Like, how is that received by the greater organization?
Yeah, I mean, I think it's definitely recognized. And, so there's sort of those tangible, oh, that was great. Mm-hmm. You guys collaborated on that. It's wonderful. Let's close that project out. Now we all win. But I think there's much more to gain intangibly. Mm-hmm. And that is the relationships that you walk away with, right? And then now it's just, it kind of organically creates more interaction because you're working from this central system. It's a shared system. Even the ticketing, I would argue, it almost makes us, even though we are all one team, we actually have our own space within this ticketing system that, even though it seems small, it just makes us all feel a little bit more cohesive. Mm-hmm. and it catapults those relationships.
Yeah. I mean, when we've had guests on, like the AI and healthcare podcast series in general, mm-hmm. and they always talk about like we're communicating wins in perpetuity. Like this is we have missions that we're out there looking to accomplish, but we're always sharing the win because it helps translate that we know what we're doing, mm-hmm. and when we work together, good things happen. And I think that like it's a two-way street.
It's a perception thing that's really important, is that people perceive the department as professional,
Right.
and that they're there for them. And what the communications center is a good example. Really, the only 24-hour, 7-day-a-week area is public safety, where and so a lot of times, you have dispatchers that are working in there, but a lot of departments rely on you to monitor not only just the security end, the police security end, but also the environmental alarms. There's nobody that's doing that in the middle of the night, and crazy things like batteries or pagers or keys or all that seems to fall into the lap of you. And a lot of people depend on that. And, having a security operations center, I'm sure, is a challenge. You want them to be proactive, and it's 24 hours. So one question I have for you is, at 3:00 in the morning, that's the president of the hospital that's sitting there. And how do you ensure that they have, I guess, the technology and the tools they need to be able to respond to a real emergency in the middle of the night?
Yeah, I mean, some of that we do it proactively. I will say that my very first job in the police department was as a dispatcher, so I have
all of us started there. It was the worst.
Huge affinity for them and respect for what they do. And,
oh God, yeah.
And so I definitely try to give them the attention and care that they need. But just being super transparent, some of it we learned by the mistakes we've had.
Yep.
Right. So we were like,
Yep.
oh, well, that didn't go as planned. And so let's not shoot the messenger, if you will.
Right.
Let's really, one of my former chiefs, he used to always say to me that if you didn't get what you wanted, what you asked for, you didn't communicate it correctly. And that's what he would always say. He's like, people aren't typically just not doing what you ask them to do.
Right.
And so that's usually the point I try to start at, and then we kind of unpack, all right, what were we missing, or what did we miss that made this emergency notification not go out as planned, or
Right.
for them not to automatically think, oh, I should have looked at this camera,
Yeah.
Yeah.
And sometimes learning by mistakes, it's okay to say that. I used to say to my guys, just tell me what happened. We'll fix it.
Yep.
It's okay.
That's it. Yep.
So, and you
All we
do
gotta do
learn
is tell
by
the story.
mistakes.
Yep.
And it's hard. It's hard because people don't want to admit that maybe they could have done it better. But the more trust you get in your team, that they see you as somebody that is willing to say, okay, and go through the people, process, and technology, right? If you have the right people, you have the right training, you have the right guidelines, you have the technology, you understand the expectations of the technology that you have, it's okay. Sometimes not everything's going to be perfect.
That's correct.
Well,
I wish it would be, right?
I also think, too, that it's a security blanket for the rest of the organization, knowing that there's somebody there. They want to know that there's somebody there to help them. They're around the clock.
Yeah, and for visitors as well. When visitors come into the hospital and they see a professional police department or security department, it makes them feel safer, and then they feel safer about their loved ones in the facility as well.
Well, it's something as simple as this. There are plenty of locations that we have that the doors are locked at a certain time of day, and the only thing that's there is an audio intercom. So the very first impression that people will get of our health system is from that dispatcher sitting in that room who answers that intercom, and how they speak to them, and what instructions they give them, and what they say to them. They are Lee Health. They are all things Lee Health in that moment. And so, whether I politely guide them, oh, these doors are locked. What are you here for? Okay, it's an emergency. You really need to visit your loved one. You can go around to the emergency room. You can use that space. It's that versus these doors are locked, and that's it. Or worse, a recording that says these doors are locked, right?
Right.
So, and I think to your point, Paul, is that not only there are places where there's 24/7, we're the only place, with the exception of our PBX and switchboard operators, where 24/7 you're gonna get a human answer the phone. That's the difference. There's nurses all throughout the hospital, but calling that nurse's station desk, you're not always going to get a person,
Right.
Well, and they're at bedside. They're providing care.
Yeah.
They're a care team focused and organization, and that's really kind of where it goes. Now, one of the things that was interesting you said too was specifically kind of about like the automation aspect.
Mm-hmm.
And that's kind of what I call like the pre-recorded aspect. I call it automation.
Mm-hmm.
And so there is a lot of AI models out there. And I think we literally talked about this ad nauseum on the AI healthcare podcast. Like we have, but there is a lot of varying degrees of abilities within the market. And I think sometimes systems, let's say hospital systems, are very focused on the benefit and not necessarily all what goes on behind the scenes bringing them that benefit. And I think that that's where things can get dicey. Not always, just they can. And I kind of want to just talk about where you're seeing successes, what's working, what's not. In the artificial intelligence industry, there are fantastic industrialized solutions, enterprise grade stuff. And then there's the hopium based products where they are literally, it's a demo and that's all they got. And it's, it's some sort of canned model that they're just pumping out into the market, and it's all marketing that's really kind of generating its perceived value. It's not always like this. It's just, it pushes, if it goes that way, it pushes all the complexities of the artificial intelligence industry on the end user, the hospital system in this case, to figure out a functional workflow. And like if it's in a care team environment, they're fantastic at workarounds, but they shouldn't be doing that. The system should be working for them, right? And so how is Lee Health evaluating like an artificial intelligence model that they're like potentially considering moving into a production, whether it's a security workflow or anything else for that matter?
Yeah, well, I think our IS team has done, and we're probably not unique in this, but they very quickly stood up a completely separate sector that within IS. There's a director in that area. They've got, team members that are in that space. They hired team members in that space that are solely focused on the AI enterprise systems. So they are the ones that are looking at vetting, reviewing those sorts of things.
I just think too with AI, I hope you agree with me, Gloria, is that when analytics first really became a big thing, people came in and they talked about their analytics, how great they were and what they would do, and then they didn't perform at the level they sold them to us as. And so basically you started turning them off. And that's a problem with was a problem with analytics. And now as analytics are improving, I think it's important that you set expectations. And that's where I see AI is, it's not a brain. It's information that you put into it. It's training the analytic or the AI, the model.
You can call it 100 different
and
things.
You have to, and you and I have both been around long enough. We've seen this, and it bothers me when I listen to some people with AI, and I think, you're really not selling or telling people the exact truth of how this is working today, and it's going to improve. But are you at all nervous about it today?
Yeah, I am, and I'll tell you, Paul. So twice now I've heard you say, I've heard you talk about the expectations of the technology, right?
Yeah.
And as a director, and as a person who's a decision maker, so my boss and my health system, my employer, trusts me largely to make pretty big decisions as it relates to safety and security technology. And so I don't take that privilege lightly. And so I'm very much about measure twice, cut once, and looking at tried and true versus being the first one to try something. And especially if it's, I'm not against piloting things and stuff like that, but if it's, jumping all in and trying to encourage my boss on things, she's very smart. She's very, very in tune with what's going on in a lot of different areas, but she relies on me to give her truthful, good, credible information. So two things. I think one, my expectations have to be right. So time, place, manner, right? So what is it that I'm trying to solve for? Being very explicit with whoever it is I'm working with, whoever the technology provider is, about what it is I'm trying to solve for. And then understanding what my options are. Okay, we can solve for that, 50, 60%, or we can solve for it 100%. And then knowing who my service provider is, right? And understanding who they are and are they going to be around tomorrow and that sort of thing. And I think that's what causes me concern with all of these sort of pop-up AI technologies is really my confidence level my confidence level in the will they be here tomorrow, and I'm being in police work for decades. I'm very jaded and very skeptical of most things.
Yep.
So I ask a
Yep.
lot of questions.
Yep.
And I'll even go back to the intercom when I made the comment a moment ago about, they don't want to hear a message. There are places where that's very, in fact, I was just sharing with one of my colleagues that, I'm looking to automate overhead paging for certain kinds of calls so that message sounds the same way
Branding.
every single time,
Right.
that it's not up to 26 different operators in the way that they page it, because it's so critical. It's so important. And so, there's time, place, and manner, right?
Yeah. And the people that are in the PBX are really behind the scenes and really have a hugely important job in the hospital that a lot of people, I don't know, they don't realize it. And they have they're the ones that are really calling those codes and making those decisions.
Mm-hmm.
They're not just taking phone calls and transferring calls anymore. So it's
No,
a tough
not.
job.
Yeah. I keep statistics on most things in my department, and any given month, 92 to 100,000 calls per month that team's answering.
Can you imagine that?
Yeah.
It's more
lot of
than
calls.
any
Yep.
That's a
any
lot of
small
calls.
police department.
Mm-hmm.
Well, and plus, like you said, you're open all the time. They're flowing you 5 locations, major locations, that is.
Mhm.
You're getting a lot through there. And I think, too, if we could just chat just a minute more on kind of like the IS team. You mentioned the IS team is evaluating it. I know some really common questions are like, what is the ground truth here? Is there any sort of a biases associated with the model being trained?
Mhm.
Did you buy this data? Do you have this data that you trained the model with? I think that's kind of like, you need to show your cards today. And I
Mhm.
think that's where some of the expectations go awry, is if that person bringing that model to market doesn't own the things that which they brought to market.
Mhm.
And that's where I think expectations sometimes get a little wild.
Mhm.
And the one thing, like in the security industry, we're always bound by is reality. The security theater concept, it needs to go away. And these people that are pushing this into the ecosystem, it's not helpful.
Mhm.
It's not helpful. And so you talk about expectations. I mean, what would you expect from a product? Like, what level of accuracy would you expect from a product in general? And I mean, it may depend on the technology too. So, but like, I mean, you could pick one if you'd like.
Yeah, so you have varying levels of risk, right, that you're willing to assume, or reliability, if you will.
Mhm.
Depends on what what it is we're talking about. I think about, things like fall detection.
Mhm.
I think about that. You want that to be pretty darn accurate,
Mhm.
because nurses are very, very busy, and their workload is large, right?
Yeah.
And so they need for those alarms to be very credible.
Mhm.
You think about, now can I assume a little more risk, or a little less reliability on things that are much more smaller scale, like perhaps, did you think that this truck was red versus it's orange, that kind of thing. That's probably not the best example.
No, I
on
think it's a
Earth,
great
but
example.
yeah.
Actually, I think it's fantastic.
But yeah, I can accept something a little bit different there. But when you start talking, I think when you're talking about things that have to do with people, you need to be pretty accurate when you're dealing with things that have to do with people.
Well, especially with like with falls being
Mhm.
such a high, we've talked about it a ton, but it's a great example too, because it's such a high cause of injury within a
Mhm.
hospital.
Yep.
Mhm.
And they're coming there for care. So, I mean, it's also not a great patient experience if these
Yeah,
things
and there's a lot of people that do slip and falls, and they really don't
Yeah.
slip and fall.
Yeah.
And you have to, and you're using your technology to prove that.
Or what else? I mean, I think about some of the wearable, the fall detection in the wearable, that's going to trigger my camera to come on.
Mhm.
That's huge.
Mhm.
Yep.
That's
It is a form of
yeah.
automation.
Mhm.
Yeah. And I don't know that that's fully AI, but that is most certainly automation.
Mhm.
And that is one
Yeah.
of those things where I think that's blending a little bit together too in the industry as a whole. I think people are kind of doing that. And it's like, it's in a weird way kind of natural, because they're assuming the automation aspect is actually some sort of AI model running it, but it might just be a sensor.
I would say that's me for sure.
Oh,
Because
well,
in my
there's so many
head,
people.
because again, I'm running operations.
Mhm.
I know just enough about our technology
Mm-hmm.
to annoy my integrators or my team members, right?
Yeah.
And so I definitely think that's a very accurate statement. Yep.
Well, and so that's also it's compounded by the fact that a lot of the industry is advertising things as AI when it's really just an automation workflow. It's just a sensor tripping, and it's like, well, where's the artificial?
There isn't
what happened here? Yeah. And so I think that's one of those, like when you talk about perceiving it, getting an expected result, and you might not need an AI model to do everything. It doesn't. It's not the end all be all, and that's I'm pretty firm on that. I don't know that it translates well with all the podcasts we do on it, but it's not the end all be all. And I still very much believe in a human being making all those critical decisions, especially because we don't measure intent.
Right.
We're not out there saying, oh, they're going to do this. And I think like the EU has done a wonderful job with their AI Act of saying, don't measure intent, because you can't do that.
Right.
You need to bring in relevant information. It's fine if you're utilizing an AI model to do that, but we're not assuming. And you guys both being ex-law enforcement, I mean, you guys probably could lecture me on that. But maybe you can talk just a minute about that, of like, these are the types of things where they didn't mean that. And so that didn't happen like that. And so maybe you can just.
I mean, I think the first thing that comes to mind is weapons detection for me. The vast majority of weapons that we intercept through weapons detection systems, they did not mean there was nothing nefarious associated with it. They either forgot, didn't realize that they could not bring it in, or something along those lines.
It's a multi-tool is in his pocket because he was coming from work. Yep. I mean, I totally get that.
So does it, quote unquote, break the law? It does. But are we going to, follow up on anything like that? No, because the intent is not there.
Yeah, there needs to be a human being. And besides, you're serving the community, and those people are part of the community. They're part of like the fabric of the business of the hospital itself. Right. So, no, I think this was really good. I think, is there anything else, Paul, you want to, you got a burning desire to talk about here?
No, I think it was good. I again, I always go back to ensure you think about people, process, and technology when anything that you're going to do. And then, like you said, I think it's making sure that you're making the right decision. These companies that pop up, make sure that they're going to be around and support you. And then technical support that you get from a company is really important, that they're there for you every day.
Yep.
But it's been an honor to sit with you. I came into healthcare with a law enforcement background, very similar to you. Thought I knew everything, and quickly learned that healthcare is a totally different animal. And I know that you have done the same thing. You came in and you made a lot of incredible changes. So
yeah, it's been I learn something new every day. It's it has been I've never looked back from joining healthcare. And so I love working for an organization that fundamentally you align with their values. That's so important. Yep. And I mean, what better mission than to heal people, right? And that's what we're there to do, is to make sure that the healers are able to do what they need to do. Yeah,
the sense of accomplishment is incredible as part of any sort of organization.
Yep.
So, no, I think with that, thank you all for listening in. Really appreciate you guys joining the podcast. We're going to have a few more access technologies and healthcare podcasts in general, but I think made sense to kind of do this first with the programmatic oversight, the human aspect per se of this. So thank you all for listening in. We really appreciate you. This will be available on the Access USA YouTube channel, along with the rest of the other series, as well as the Access Artificial Intelligence and Healthcare podcast series. So thanks all, and hope to see you on the next one.
Thanks, Matt.
Thank you.
Thank you.
Thanks, Gloria.